Hi, we are
Hi.
here today with Jallicia Jolly, who is a postdoctoral fellow in American Studies and Black Studies at Amherst College and just finished her PhD at the University of Michigan. Hi, Jallicia.
Hi.
Thanks for joining us.
Thank you for having me.
And the reason that I was hoping we could have a conversation today is your work is amazing, and I'm always interested to talk to you about it. But you have recently published an article in Ms. Magazine called Working to Die, How Black Women Healthcare Workers Survive a Pandemic. That is incredibly powerful and important. And I'm so happy that you have a few minutes to talk with us today about it.
Yes, I'm looking forward to the conversation, and thank you for inviting me.
Thank you for coming. Do you want to start maybe by telling us a little bit about your article and what inspired you to write it?
Indeed. So it was during the time of the height of the pandemic, and I was watching the discourse about healthcare heroes and looking at sort of which heroes were sort of being centered in the discourse, what the discourse meant, what kind of labor it was emphasizing on the front line, which was definitely important labor in terms of addressing the pandemic, its fast transmission, and its disproportionate impact of people, particularly people of color, as we found out as the racial data came about. And I was witnessing at this time just sort of which communities' work was emphasized, and in a largely feminized labor force, healthcare workers, particularly nursing aides, personal aides, home healthcare aides, much of which make up women of color. Women of color make up much of this labor force. I was thinking just about what it meant to highlight this labor, this valuable labor, but also what the exclusion of this kind of labor in the time of a pandemic meant for people who were on the front lines doing this kind of work.
Right.
And so I wanted to sort of highlight this, highlight the work and the voices of people doing this labor, but also to think broadly about what the kind of racialized and gendered understandings of responses to pandemic meant.
Right.
And in particularly to think about COVID-19 and which labor, which lives, and which deaths and which experiences of illness were excluded from the larger conversation and discussions about the pandemic.
I think that's really amazing. And, the phrase you just used, which labor and which lives, I think boils down such an important part of that. They're talking about doctors, and there is this lacuna of dealing with the fact that actually the majority of the people that are doing the actual physical caregiving in hospitals, in healthcare settings, and in homes are often women of color. And that is something that is really absent, I think, from the media. That's what I gathered.
Absolutely. Yeah. Yes. And what I think what it boils down to is kind of I would say the sort of political and social capital and that comes with the professions of doctors, right?
Right.
In a way that is not transferred to other sectors of the healthcare when we think about nursing aid, home healthcare aides, home aides. And so for me, what this brings up is kind of like which labor is viewed as expendable and which is viewed as crucial or essential, right? In a time of a crisis like this. And I think what we see and what the sort of large sketch of response to that question is really that it's really that the labor of women of color on the front lines is really more expendable than sort of other frontline workers. And I would say broadly people of color, right? When you think about who the food workers are, when you think about who the janitors are, the people cleaning the instruments used in hospitals, cleaning the spaces of clinics, in other settings where people access healthcare during the time of the pandemic and beyond. A lot of these people are not people who are working at home on Zoom conversations,
right.
And who are logging into their accounts to sort of check emails and remain safely at home, right? These aren't sheltered at home folks. These are people who are going out on the front line and in different ways, in close proximity in intimate contact with their clients. Whether you can think about nursing aides who, have a sort of very defined care plan and have to take care of physically touch, wipe, grocery shopping for, sort of a spectrum of care services and labor that is not always accounted for in the sort of dominant conversations about who the heroes are.
Right. Oh. And I think that you do such a powerful job of laying out the different layers of risk and vulnerability that are there, that in this particular moment with COVID we're seeing come to the surface, but that there are also these long-term, long-standing violent forces that are shaping the lives of women of color. And one of the phrases that you use in the article is that you think a reproductive justice approach to handling this crisis is needed to protect patients and to protect healthcare workers. And I wonder if you could tell us a little bit more about what that approach might look like.
So a reproductive justice approach considers the right to life, to give birth, to parent, to sustain life, and to live in conditions that are safe, that are necessary to prolong and cultivate life. And so when I think about a reproductive justice approach, one of the prominent scholars, practitioners in this field of work really considers it on a broad spectrum of both accessing the resources to be able to live and to be able to make decisions about your body, about your reproductive autonomy and in different respects, but also to be able to be free of coercion, of violence, right? So we can think about this across multiple spheres. We can think about this in the context of health services and access to contraceptives, for example. We can think about this in our current time of increasing recordings of police brutality, because they've always been around. They just happen to be on film right now, of police brutality and the sort of state-sanctioned violence and in different ways. So brutality being one of them, but also we can think about state-sanctioned violence in terms of the lack of sort of social welfare services and programs that are necessary to care for the well-being of working class and poor families. And so you can think about just the multiple ways systems intersect to undermine the quality of life in different ways. And what an RJ approach considers is how might we take an intersectional sort of understanding of power and of domination to be able to address the multiple sites of power that restrict one's access to freedom, to reproductive control, to life. And so in this piece, when I took a reproductive justice lens to really think about, to trouble the discourse of healthcare heroes, and to think about, women of color's care labor in this context of a pandemic crisis, but also to extend it further to even thinking about what this means in the larger context of the access to a quality life, right? To safer communities, to the resources necessary to survive a pandemic, not just to be on the front line caring for the making sure other people survive a pandemic, but what does it mean for marginalized Black women, for women of color, for people to be working on the forefront and the front lines, and to be able to access the resources they need to live, right? So that can mean quarantine pay, right? So if you're not being able to go to work, does that mean you absolutely have no income, right? Of course, that creates a disincentive to want to stay home to be quarantined. This is sort of political advocacy so that healthcare workers, particularly nursing aides, home health care, aides and personal aides, can be able to be elevated, their needs, their concerns, and voice within the larger conversations about who has access to PPE, protective equipment, protective gear and equipment for sort of reducing transmission of the virus, right? Particularly while working in conditions that can expose you to higher risk. So thinking about these multiple contexts that intersect, but when they're discussed in policy and normative mainstream discussions about the pandemic, it's often discussed in these sort of isolated conversations, right? In a way that doesn't consider how a healthcare hero whose labor has historically been exploited and also just not viewed as essential can now be somehow framed as a victor, and to be real, as a martyr,
right,
in a battle for the necessary resources to live,
right,
before this pandemic, during the pandemic, and after the pandemic.
Yeah, that's really powerful. In our preparation for talking today, you selected 3 images from Uma's collection that relate to some of the themes that you're talking about. And I'm going to see if I can bring them up on the screen. Great. Yeah, so the first image that you chose is one from Jacob Lawrence called Builders that was made in 1974. And I love this image, and I'm really interested to hear how you feel that it relates to what's happening right now.
Why do you love this image?
Why do I love it?
Yeah.
When I look at it, I see a family who is building and constructing a life for themselves. And I think it's really fascinating. I mean, this is what I see. I'm interested in what you see. But I think it's really interesting, and in the background, you see that happening in what looks like the context of, I see a city, and so you see it happening like in a physical level, but then you also see it happening just in their personal life. And I think the smiles on the face of the family are also really interesting. But what do you see?
Yeah, no, that's really deep. So I love this image because of its sort of vibrancy, and I think it's able to bring together seemingly contradictory sort of aspects of kind of, like construction workers, people, working hard, manual labor. But then you also have what appears to be this Black family that is, dressed well, walking with children. So on one hand, I see sort of this reconstruction of this life, but on the other hand, I see what it seems to be some people who, to some respect and regard, definitely not fully, is able to access some sort of benefit from this construction of this life, or from this transformation, this building, this collective building. When I initially chose this image, I think it was, I appreciated seeing sort of the ordinariness of just daily life, and Black people moving through space within that, right? Caring for children, caring for self, creating communities, building, working, laboring, and keeping it moving.
Yeah.
And so you get a bit of just kind of, you see labor, but you also see a little bit of culture, you see hope. And I think in this moment, one of the things I've been thinking about is together is hope, and the labor that is required to be able to hope in context of precarity and just deep intensity, where not even survival is guaranteed. But to continue doing that work of hoping and living and caring for families, for children, for kin, and working anyway.
That reminds me of what you talk about in the article about the kind of communities of care that some women healthcare workers are trying to create, and caring for themselves, caring for each other. And I was very moved by that. And I think it's funny because, you can look at an image or a painting a million times and every time see something new in it. But looking at this image too, I really appreciate what you pointed out about that sort of like different layers of working and labor that's happening. That you have that construction of family and hope on one level, but then you also have that different levels of exposure, you could say, right? To risk and to, the ability to take time off.
Yeah, absolutely.
So this image is called Carting the Dead in Kerch, Crimea. And this was a photograph taken in 1942 by Dmitry Baltamont. And this is a very devastating image in so many ways. And I see some obvious resonance, right, with what's been happening with the pandemic. But I would love to hear your thoughts of why you chose it.
So when I first saw this image, the first thing that I thought of, my visceral sort of response was death in its very lived form. I also thought of, when I saw this image, I also thought about the refrigerator trucks in front of New York City, right? And how they held the dead when there were not enough space in the morgues, or when they were being amassed so vast in ways that they couldn't find spaces to hold dead bodies. And I thought of that in sort of juxtaposing the desire and the will to live, to continue on, but to also care for the dead and dying, and how that often doesn't get captured. The sort of the tedious emotional labor, the physical labor, the sort of spiritual toll, the holistic toll that's required to care for the dead and dying is not always captured and publicized, especially when we think about how that labor is unevenly distributed, and many times, and we can even think about in the context of the article, where I was emphasizing in particular Black women who are working as healthcare workers and taking care of the dead and dying in different ways in nursing homes, in home care spaces, but particularly in nursing homes where sort of death, because of the risk population, because of the demographic, and the sort of different forms of exposure, the pandemic had a devastating impact in that context. And so I started thinking about what it means to amass the dead, and to care for the dying amidst this sort of intent to live and to care nonetheless, even with the sort of stacks, the odds stacked against certain populations, and especially when we think about the way mortality is exposure to death and low death is distributed in different ways across lines of race, of ethnicity, of citizenship status, of zip code, and the way in which some death mobilizes with fierce intent than others. And, you get a sense of sort of anguish, but kind of like life has to carry on, and the work must continue.
Yeah.
And so the question that comes to mind for me is where is the space to grieve? Where is the space to mourn lives, but also where is the space to mourn a slow death that has been happening in different ways when you think about sort of underinvestments of resources in communities, particularly communities of color, when you think about sort of medical neglect and clinical violence that has been, sort of historically happening in different ways. And so here we have a moment of crisis where we know that not all lives matter, right? And where we know that in a context where all lives don't matter, and where in particular Black lives don't matter, as it's viewed by our policy and discourse, not because I believe that it doesn't, they don't. What then does it mean for death in general, and in particular Black death to not matter, but also to not even invoke the moral sentiment and compassion that one usually gives the dead white bodies, right?
Yeah.
So it's really interesting to think about these sort of how these uneven processes are historically embedded, but are definitely present in our current moment, and have different repercussions for how one devises a national response to the pandemic, how one decides which resources to allocate to care for the sick and dying, and to be able to sort of amass the political will in order to, develop that multi-pronged approach that is needed to help people get out of a pandemic or a recession, which we now are in different ways.
Absolutely. That's really powerful. And the ordinariness, I think, societally, of some people's deaths that are really, it's just treated as like the cost of doing business in a way that's soul chilling, but the way our society has functioned. And
Absolutely. And that accompanies the normalization of the slow death, right? Because slow death happens. Not, you don't have to be in a cart or in a morgue or in a refrigerated truck, right? The slow death is happening when we have sort of massive violations of human rights, when you have sort of the state invasive practices on bodies in communities, right? So you have slow death happening in different ways that we don't always see, because it doesn't always happen in the form that we imagine in a sort of concrete death, right? But it's an ongoing process that kills people.
It kills people. And with these different layers of things that kill, so things on the surface, you know, being shot by a police officer, being murdered in your bed when you are a first responder, you know, these scenarios that we're dealing with right now, visibly and on camera in the United States, are just a part of the violence that kills people. In terms of the level of risk, the lack of resources to care for yourself and your family and get through. The fact that you return to the idea of causes of hope is very powerful. And, how you find hope in a situation that is overwhelming is, I think, probably a question that everyone is dealing with in some way. But I wonder if in this image, how can we find causes of hope when the task is literally, pushing the dead through a battlefield and moving forward?
Well, that's an excellent question. And when I want to find my hope, I kind of go to the sources of the people who have been enacting change on the community level, on sort of enact a broad-based change on a sort of national, institutional, or even transnational level. And so I don't romanticize the sort of laborious and soul-crushing work that is required to resist systems that want to kill us. And so I know that even if I did mention hope and kind of am thinking about, I've been working through what hope means in a time of mourning, in a time of death, and in a time of ongoing state-sanctioned violence. For me, hope comes in people saying that we refuse to be complacent and killed in impunity, and that our presence and our voice and our bodies will be protest, even if it means we will risk our lives, dying on the front line to do so.
Right. Yeah.
And dying on the front line differently than, having your labor be used and romanticized as a sort of heroic figure in the context of a pandemic where the state needs you to perform functions that it should have been doing a while back.
Right.
But frontline in a way that means, we will directly face institutional practices, policing strategies, and systems that are deeply invested in white supremacist logic, and confront those and deal with the repercussions that come with that. So that's where my hope lies, in that active and intentional protest. Without powerful. A guarantee of the outcome, all right? Without a guarantee for life, as we're seeing as the National Guard and police departments kill people in cold blood.
Right. And I think it's so important that you mentioned earlier that, this has been happening forever. And that a part of what's different now is that, people have camera phones. So this is who knows that it's happening and who sees that it's happening is shifting.
Absolutely. Yeah. And one thing I wanted to sort of direct to as we're thinking about mourning death, the documentation of it, how it circulates, which that's mobilized, which that's matter, and which amass political will enough to do something. And when that doesn't happen, what happens when protest takes the place of that absence of that care and will?
Yeah.
I want to direct it to that photo. One of the things I think about too, when I think about the value of death or the lack of value of certain deaths, is I think about the discourse that happened around COVID-19 and the way a process of blame unfolded in responses to COVID-19, right? So we heard about, politicians that blame Black people for their obesity and so-called positive eating habits. I kid you not. Obesity, and these were the words that were used, and even, you know, this was done by the U.S. Surgeon General, Jerome Adams, right? And as well as others who kind of said, you know, well, if you don't do this, then you won't die from COVID. If you don't, if you weren't doing this, for, you know, then you wouldn't have been at high risk, right? If it's not for those underlying conditions, you would be able to survive. And in multiple ways, I just think about where the locus of the blame is centered and where it's giving attention away from, right? Because no one's mentioned the sort of institutional practices, the policies, the type of policing, right, that have converged together. No one's mentioning the redlining and segregation, how those work to converge to really undermine the quality of life and to sort of shape Black survival for generations to come. No one is mentioning sort of the Tulsa riots where white people stormed into Black communities and destroyed their businesses, their hospital clinics, and their communities and homes. And 80 years later is when in 2000, or I think 2001 or 2000 is when sort of government actually mentioned, in Tulsa actually mentioned that this happened and they were complicit in it. And so, you know, you have these multiple processes and these legacies of just deep and explicit brutality, white violence and racism and white supremacist logics that is completely destroying communities and lives. And here you have a moment of COVID where it simply is laying bare many of the things that were true before the pandemic, that were simply magnified in this context of illness, death, care, precarity, and urgency. And kind of what it reveals is simply what we've always known to be true. And also what the article brings up, which is, you know, that the labor of people of color, particularly women of color, and especially Black women, have been viewed as disposable. Even in a moment of crisis, right? At the same time, they're constructed as heroic figures. And that means that they are expendable. So their death will just be another casualty of the state.
That's really powerful. And I think, you know, what you said too about like the blame that happens as a way of avoiding recognition of how the system works and who is at fault. You know, the autopsy report for George Floyd, you know, where he was blamed, you know, for his own death, you know, that if he didn't have previous, you know, health conditions, that, you know, and it was like, you know, this is on video. We've all seen the cause of his death, you know, so for anyone who has witnessed that, there is no question. But the fact that institutional medical voices can even, and often do, step in and side with the system that it is so deeply embedded in, I think that's a very difficult issue in terms of, you know, feet on the ground. If you're working in hospital administration, if you are, you know, a med student, you know, who's studying at the University of Michigan, and you are kind of embedded in these systems that reproduce these same, you know, violent forces, you know, finding ways to shift that and change that, you know, that are not just protesting on the street or, you know, what other way that you have, but within the choices that you're making in your line of work, how you can intervene as someone who, you know, especially for people in the medical profession, take vows to protect all human life, right? And I know the other image that you selected, which I think is really powerful with what you were just saying about protest and the power of, you know, there's sort of a different front line of standing up against death, is this image, which is a photograph that was taken by Edward Robertson in 1963. And this was taken in the midst of a protest. It's called "Tired Marchers Sleep on the Streets. We were tired, we were tired." And it's a part of a series. Why did you choose this picture?
I chose this picture because I I think tired and exhaustion are very important words that have been circulated recently. Even if you think about in a UMich context, chief diversity person Rob Sellers wrote his op-ed article, I'm tired. And, I always like to say, if administrators are tired, imagine what graduate students are feeling. We are exhausted. So we are collectively tired. And I think when I see this photo and I see Black people resting in public, and not kind of a leisurely kind of rest, right?
Yeah.
Not like we're going to put out a blanket in the park and take the sort of oak tree and just picnic and have the sunshine blaze across our face, because we are, that's all great too, but that's not what's happening here. And I see, when I see the American flag across the face and I see people sort of bodies intricately connected with each other, laying there in public like this, I just think about just the lack of space that there often is to publicly say this, to publicly say this, and to validate those emotions, knowing that the broad-based change can't happen if the engine stops, right? So knowing that there's also so much pressure to be productive, to actively be fighting, to continuously be having to validate your worth, your human well-being, right? Now, don't get me wrong. I'm going to actively be fighting, and I'm going to work with others to make sure I keep the engine working, right? And it's important for us to also rest and take that step back and to really reflect and to sort of grease the engines to keep it moving forward. But I think what this brings up for me that connects to sort of the piece too is that when what does it mean to care for yourself and to care for your community, especially when those are so intricately connected, self and community, right? And they're not viewed as sort of isolated or mutually exclusive, especially in contexts where your community and you are being hunted. I've been thinking about just what it means to do this care labor work, but to also face real moments and experiences of exhaustion, of
that's incredibly powerful,
and especially because a moment of exhaustion is not necessarily like a sort of one-time thing, right? I think the condition of Blackness in America is such that you're constantly fighting you're constantly fighting the devaluation of your life, and so the ongoing condition of Blackness is exhaustion, fatigue. But not from your own Blackness, but by the imagination of white folks, right? Or one would say because of the poor imagination of white folks, right? Typically, quite frankly, it's that there's an exhaustion that comes with having to look white supremacist violence, xenophobia, homophobia, classism, racism, sexism, and all of these isms together, but particularly overlaid with anti-Blackness, there's an exhaustion that comes with that, right? But it's ongoing, and it undergirds the work that needs to be done, because if we stop, there will be no people held accountable, right? The officers who used their crushing weight of white supremacy through their knees on George Floyd's neck, that they wouldn't have been arrested, right? Breonna Taylor's killer in her case wouldn't have reopened if there wasn't this move to continue doing that work, right? And so many others that we can think about. And so the work continues, but the exhaustion is so real.
Wow. Jallicia, thank you so much for sharing your expertise and your insights about this, especially during such a intense time. And, it means the world that you took the time, to talk with me today. As we wrap up, is there anything, maybe that we haven't touched on that you think is important or that you would want to say or share before we
I want to say thank you for having this space and for doing this. I think it's so important. I always think art and activism go hand in hand, and art for me is message to the soul, particularly when the soul is being violently attacked and hunted and killed.
Yeah.
It's really important to, I guess, find spaces to sort of interweave these conversations across disciplines, across generations of movements, and across other divides. And so I really appreciate the space to be able to converse about this. And one of the quotes that I always refer to when I'm thinking about, in reference to our recent image of exhaustion and, moving forward and sort of leveraging your labor, your talents, your skills, your networks to sort of enact this broad-based change on a broader level. It's a quote by Assata Shakur. And following up on what I just said about sort of the value of thinking about art and activism together, and not just art for the sake of art, right? But art for the sake of what it reveals about the human condition and the power, the transformative power it has to heal, but to completely disrupt the kinds of logics that will kill us all, right? Not just Black folks, it will kill us all. And so one of the quote that I love to refer to is, "You died, I cried, and kept on getting up, a little slower and a lot more deadly."
Wow.
And so that's where I am right now. Thank you.
Thank you so